And during evaluation of an abdominal aortic aneurysm, you discovered that there is a horseshoe kidney. How do you want to approach the patient? Fundamentally, what is the reason for the horseshoe kidney, doctor? It is basically a vascular anomaly in the embryonic life. And if you discover it, if you have to repair aortic aneurysm, since renal vessels originate from aorta, you need to take a retroperitoneal approach and implant the anomalous renal arteries in addition to repairing the aortic aneurysm is the call to be taken. Now, doctor, you need to give me one, audio is not clear, just check no. Is the voice not clear? Are you sure? You like to say adrenaline? I mean epinephrine, not norepinephrine? Audio not clear? Clear? Anybody else has an audio issue? Just check with Anandapur also, no? Is audio clear or not? Adrenaline is a proposal coming from Sunain. I asked which catecholamine? Adrenaline or noradrenaline or isoprenaline or dopamine or dobutamine? Which one do you want to prefer for anaphylaxis, glaucoma, asthma, hypotension? Or phenylephrine? Which one do you want to prefer? Adrenaline, epinephrine you mean, not norepinephrine. So doctor, it all depends on alpha 1, alpha 2, beta 1, beta 2, D1 activity. If you take epinephrine, epinephrine has an activity even on beta 2. Norepinephrine has nil activity on beta 2. Isoproterenol has no activity on alpha 1, alpha 2 at all. It has only action on beta 1, beta 2. And dopamine has an action on all of them. And dobutamine, especially on the beta 1 which is there in the heart, it has the maximum activity. This is one table which should be there in the mind, because favorite question of the examiner. As all the people who answered it as still audio problem is there. Is it okay? The audio okay or local settings were not okay? Check it now. Is it okay? If it is still not okay, please shoot. Our job is to see that you get a correct transmission. Alright, doc. One thing you need to know. Phenylephrine, especially alpha 1 highest activity. Okay, doc? So, for anaphylaxis, glaucoma, everything, epinephrine is correct. AV block, we use isoproterenol. And for the shock, heart failure, dopamine. And pupillary dilation, phenylephrine. So these are the things which need to be very, very clear about. Still, Anuja says bad audio. Yes. Others are saying audio is okay. Do you need to do some local settings? Sure. Oh, I see. No, bad audio. Bad audio is there. Clear says everybody. Anyway, please let me know. Okay. How do you identify genitourinary TB? Basically with the microscopic hematuria. Is one of the very early findings in the case of the genitourinary TB. Was there any other answer you proposed, doctor? Sterile pyuria? There are other causes of sterile pyuria. If I take antibiotic also, I may have sterile pyuria. Culture may be negative, but organisms found. Kind of a thing. Okay. Now, doctor, familial polyposis, 100% carcinoma risk. You need to do polypectomy. Ulnar nerve innervates, flexor carpi ulnaris, everything but not hypothenar musculature, everything, but not abductor pollicis longus. That's right. Now radial nerve innervates everything except lumbricals of the ring and little, which is innervated by ulnar or median. That's good. Now coming to the orthopedic assessment, everything is true, but not the oblique view, and interphalangeal joint subluxation, carpal instability may not be quite evident on the oblique view. Most of the times we take APN lateral view, and phalangeal fracture pattern ke liye we do oblique view. We take a tangential view, especially for carpometacarpal loss, and carpal tunnel view to know the fracture of the hook of hamate, and we take a stress view to allow the assessment of the ligamentous instability. So these are all the various views. Now comes the next important question. Which is that indirectly acting sympathomimetic which is used for narcolepsy, obesity and attention deficit disorder? Who will give the correct confident answer? Narcolepsy, obesity, attention deficit. To treat all that we use one indirect sympathomimetic agent. Which one it is? Yes, doctor. Stalwarts of NEETPG. Autonomic nervous system pharmacology, doctor. Whole mantra lies with that. If you are sure with that, you are confident with entire pharmacology. Modafinil, Anjum proposed, which is not true, but a good guess. Imipramine, Abhi proposes. See, you have amphetamine, which is an indirect general agonist, which will release the stored catecholamines. It directly won't have a epinephrine like activity, it will make release of them. Then ephedrine is another indirect general agonist which releases the stored catecholamines, which is used for nasal decongestion. Cocaine is another indirect agonist, uptake inhibitor, which causes vasoconstriction and uses as the local anesthetic. Amphetamine, ephedrine, cocaine as the indirectly acting sympathomimetics, you are not going to forget. There is post-tetantic potentiation if it is depolarizing block. Then with regard to the duration of a depolarizing neuromuscular blocker, in case of healthy neonates, resistance will be higher, sensitivity will be lesser. Why? Because what factors will affect the non-depolarizing agents? Early administration of suction alcohol, it will potentiate. Concomitant administration of an inhalational agent, it will potentiate. Changes in the pH, temperature, age is very important. If it is a healthy neonate, they have a very high amount of extracellular volume than adults, and that will create more drug resistance to the non-depolarizing agents. In the case of the healthy neonates is what you need to remember. Now, phase 2 reactions mainly occur in cytosol. You require phase 1 redox before conjugation, not for all the drugs. Not for all the drugs. That makes D as the false statement. That's right. Now, centrally acting, you must give me one confident answer. Huh? Methyl dopa. Huh? Centrally acting alpha 2 agonist which will decrease the central adrenergic outflow used as an antihypertensive. Very good. One more drug. Methyl dopa is an answer coming from Shravani. One more answer. Clonidine. That's right. Clonidine and alpha methyl dopa. Centrally acting alpha 2 agonist which will decrease the central sympathetic outflow. That's good. Giant cell tumor. 50% are there around the knee joint, not elbow. But most of them they occur in long bones. Osteogenic sarcoma. Most lesions are mixture of both lytic and also sclerotic component. Simple bones it is the metaphysis where they are found most commonly, not in the diaphysis. Shoot me an answer. Alpha 2 selective antagonist, which we use for treating depression. These are all South Central Railway Palli Batani questions, they are called as. So, while you are travelling in the Mumbai suburban rail, eating few Batani, you need to revise the subject by this kind of flashcards. Whole thrill in a preparation for entrance is this kind of questions only. Okay, doc. Yohimbin is that vague answer coming from the galaxy, from Anantapur. Sunain also is seconding Yohimbin. Really do we use it for treating depression? Alpha 2. I am not okay. Let us look at alpha blockers. Phenoxybenzamine, phentolamine. They are non-selective. They don't see who is alpha 1, who is alpha 2. They go and attack everybody. Prazosin, terrazosin, doxazosin. They are all alpha 1 selective, which are used in BPH everything. Mirtazapine is a alpha 2 selective alpha blocker, which is used for the treatment of depression. Doctor, autonomic nervous system, pharmacology. You have to. State or NEET, doesn't matter, but you need to be very sure. Now, coming to vaccines. Polio has an ability to spread to the susceptible people in the immediate environment, which is true, even from the vaccine, which is responsible for vaccine associated episodes. If it is a previous classical cesarean, we don't try to do cesarean after vaginal delivery. I mean vaginal delivery after cesarean, we back. Coming to the PIH. Suppose if the first child Ramu is because of Rajesh Khanna, if the second child Lakshman is because of somebody else, then the chances of preeclampsia in the second birth are higher. What is the reason? The reason is, for the preeclampsia, there is an immunological theory which is being proposed. The first child Ramu created a different immunological response which will react in the second pregnancy due to the another father, and that will worsen. So because of this observation, they said preeclampsia has an immunological basis depending on who is the fetus. Will also decide. But what is the treatment of eclampsia any day? Fetus is responsible for all problems, remove the fetus. Marriage is responsible for all problems, get divorced. So that is the treatment of eclampsia.